indeed for joining us and welcome to the program.
Yeah, thank you for having me, and good morning to all your listeners.
Let's begin with the basics. What exactly is chikungunya and how does it compare with other mosquito-borne diseases like dengue or malaria?
Okay, thank you. So let's start. What the names mean? What chikungunya name means? Yeah, so chikungunya come from a language that's shared between northern Mozambique and Tanzania called Kimakonde, which means the one that bends up. Why that? Because you get such sore joints, yes, such as in your knees, in your elbows, that you really stay on bed bending. So that's the main characteristic of this virus, yeah. And so it is a different virus from dengue. Dengue is also a virus, but it is also transmitted by mosquito, the same mosquito, Aedes aegypti, yeah, and Aedes albopicus. And that are mosquitoes that are most prevalent in urban areas. So chikungunya and dengue tend to be diseases that are transmitted in urban or peri-urban areas, yeah, with a mosquito that it is different from the malaria mosquito, yeah. And that's why the world worry a lot of times more about chikungunya and dengue than malaria, because malaria tend to be more in rural and peri-urban areas, but chikungunya and dengue can enter big urban centers. So this new epidemic of chikungunya, it is started really in the beginning of the year in the Reunion Island. So Reunion Island, it is part of the French territory, and they had a massive outbreak, 50,000 people infected in Reunion, and Reunion is a small island. And so from there, the virus is spread to Mauritius. But when arriving in Mauritius, the Mauritian authorities are already prepared to respond. And it also arrived when the mosquito population is going down. It was arriving kind of getting to the winter. And Mauritius had an outbreak, but much smaller than Reunion. And then from there, from Reunion, it spread to France. We have over 1,000 introductions to France, it spread to Kenya, and we have reasons to believe that's exactly the same variant of the virus that's now spreading through Asia and have entered China.
All right, so 240,000 people in China, I believe, alone, and I mean, across 16 countries, 90 deaths already. Do we know how many people have been infected in South Africa so far? And should we be concerned about a spread in South Africa and maybe neighboring countries?
Okay, so what we know about South Africa and neighboring countries, we know that we're gonna, if this virus keeps spreading around the world and people travel, yeah, we have big mobility, yeah, we're gonna get multiple introductions. So the NICD, the National Institute of Communicable Disease, already confirmed 10 introductions. What it mean an introduction? Someone that arrived in South Africa sick, yeah, and then when test, it is positive. But given that South Africa and the neighboring countries at the moment in the winter season, when the mosquito population is very low, we have no reason to believe that now during the winter and the spring that this virus will circulate and will be transmitted by mosquito in South Africa. However, we have to be a little bit better prepared when come our summer months when the mosquito population increases in certain parts of the country.
How does the virus actually spread?
Okay, so how the virus is spread? So this is a group of virus that it's called arbovirus. Yeah, so this means that they are spreaded by arthropods. Yeah, the main arthropods that spread this group of virus are mosquitoes. So it's when mosquito bites someone that is infected and has a high viral load, it will keep that virus in the gut, yeah, together with the blood of the person. And then when bite another person, it will transfer the virus, yeah. So that is how both dengue, chikungunya, yeah, Zika, yellow fever virus are transmitted. So that is the virus that from this group called arbovirus transmitted by mosquitoes.
What kind of symptoms should people be looking out for, and how severe is this illness generally?
So let's answer your last question first. So this disease do not have what we call a high case fatality ratio. What it means, not many people that get infected get complications that end up dying. Yeah. So as you highlighted, we got close to 100 deaths from 250,000 diagnosed infections in 16 countries in 2025 alone. However, the disease can cause severe pain, especially in the joints. It can cause fever, it can cause sweating on the acute phase. But the problem of chikungunya is that sometimes the pain in the joints, yeah, it can last months or years. And that is why, for example, China is mounting such a response because the bigger effect on chikungunya, it happened on the economy, especially on people that are out of work. Yeah. In some case, it's who get mostly affected. It's people that are manual laborers. For example, if they are manual laborers and working constructions, building a road or a house, and have severe joint pains, it's very difficult to work. Yeah, so that's the bigger economic effect in labor, people that work with labor. The second one is in tourism, yeah, because people, especially if people are gonna be international travelers and are spending quite a lot of money to go to a place to enjoy themselves, they will try to avoid touristic areas. So that's, for example, why the Mauritian government, yeah, did also a very strong response, and they had very few cases of chikungunya in Mauritius, yeah. And the third one that affect a lot of which you the worry word is about the security personnel. So, for example, armies like for the United Nations or the U.S. Army, yeah, are some of the groups that spend the highest amount of resources on researching and diagnosing chikungunya because sometimes it can get a whole battalion, yeah, out of work for weeks if you have an infection sweeping.
All right, we've run out of time, but very briefly, are there treatments available against this virus?
So there is no treatment available. So what they do is try to control the symptoms, yeah. And the best advice it is prevention. So for example, and sometimes the prevention is quite simple, yeah. It is what China is doing now, what's happened a lot in Brazil, that is controlling the mosquito population. And a lot of time as simple as clear, like stagnant water from breeding sites, like from pots or old tires, yeah. And that's what we should be focusing, yeah. It's as it come the summer months to make sure that we can control the mosquito population, especially around the households.
All right, so we'll leave it there. Professor, thanks so much indeed for that very informative update. Thanks for your time.
Yeah, thank you, and wish you and your listeners a
That's
great day.
Professor Tulio de Oliveira, Director of the Center for Epidemic Response and Innovation at Stellenbosch University, talking to us about chikungunya, a virus that's brought through by mosquitoes that we need to be careful of in the coming months, particularly.